Hello, ladies and gentlemen. Thank you very much for joining me today in this live class on causes of kidney failure. We're not going to talk about the treatment because that's quite complex, and there's many different herbs and herbal formulas and rare herbs that are necessary to reverse kidney failure. And every stage and every patient is very unique, so it's too complex of a subject to talk about the herbal cure. Um, and even the diet is quite restrictive. So we're going to talk about the causes and not the signs and symptoms because it's easy to have your kidney levels function tested. You get in your metabolic panel, you can look at your creatine numbers and your eGFR, the flow rate through your kidneys. And through these numbers will determine the state of your kidneys. So we don't have to worry about studying the signs and symptoms. What we should be looking at is the causes, because most people aren't aware of the causes until they have kidney failure. And that's why this class is very important. My name is Khabir Southwick, Ayurvedic doctor, Ayurvedic herbal pharmacist in practice about 27 years, and doing Zoom appointments worldwide and providing herbal treatments based on Ayurveda um, to a wide range of clients for all conditions, including kidney failure. So, causes. Now, let's do some of the obvious ones that people I hopefully are aware of. High blood sugar. This can over time damage those small little blood vessels in the kidneys, leading to what they call diabetic, kidney failure. It's pretty well known. Unfortunately, people have high blood sugar and they don't manage it or don't take the medication, or sometimes they're even taking the medication and still not changing their diet. And so the kidneys, the numbers don't go too high, but unfortunately, the kidneys can still be adversely affected, or let's just say the small little blood vessels in the kidneys. And then the next cause, of course, is high blood pressure, and this can cause damage to these kidney blood vessels, reducing kidney function. So you can see that this combination of high blood pressure plus diabetes or high blood sugar, this is really a major cause of kidney failure. And that's often the state that I get people in, is where they've had high blood pressure and high blood sugar for some time. And it's often they're even on medication. And over, it works for 10 years, 12 years, 15 years, and then 20 years, they start to have kidney um, failure, and they're kind of surprised because they've been on their diabetic and medication and their blood sugar medication. And that's because there's another cause which nobody knows about, but the doctors are aware of it, and that's the prolonged use of many medications, including ACE2 inhibitors and non-steroidal anti-inflammatories, even just excessive use of antibiotics or some antibiotics. And many other medications can damage your kidneys, since kidneys are very sensitive and medications are all toxic. So now you've got the high blood pressure, maybe not completely managed, and you're taking a medication for it, which is damaging the kidneys slowly. And then your blood sugar is high, maybe it's not completely managed because you're not following, you're not leaving out the causes, the sweets. So this is what we call the trifecta of health problems, where it's really one of the worst situations you can have is high blood sugar, high blood pressure, and kidney failure. And you're kind of trapped at that point because the medication's causing the problem. So you have to treat the blood pressure first, which can take months, or with herbs to get that managed so you can get off the medication, because that's one of the major causes. I can't treat anybody with kidney failure if they're taking almost any medication. So all the medication has to be resolved for every health condition you have, and every medication you have only makes the case more complicated. And of course, if you have high blood sugar at the same time, with or without medication, this becomes another need to treat, another condition that has to be treated. So it's usually just not like, oh, here's the herbs for your kidney failure. Oh, no, we have to treat the blood pressure and the blood sugar as well. There are other causes, just like inflammation of the kidneys, which inflames the filtering units. And this is usually caused by infections, maybe sometimes autoimmune conditions. And then there's growths in the kidneys impairing their function. Many people say these are all genetic, but I have successfully treated them. And if you catch them in the early stages, I don't think it's going to lead to kidney failure. And I personally haven't had people that came in and said, "Hey, I have kidney failure because of a cyst." I've had people who had other high blood pressure plus um, taking medication for 20 years, particularly the ACE2 inhibitors, and turned out to have cysts. So maybe it was one of the other factors. And then, of course, one of the other factors, I think, not main cause, can just be any obstruction with the urinary tract, like kidney stones. And for men, large prostates, or of course, a tumor blocking the flow, leading to kidney damage, because any blocking in the flow, even large prostate, will eventually affect the kidneys and the bladder. And of course, just kidney infection. Chronic infections can scar and damage the kidney tissue. Some autoimmune conditions. Now, I'm here to not just kind of repeat everything that's uh, can damage your kidneys and lead to kidney failure, but share with you my experience and why the majority of people come to me. And that's really what's important. This is a problem we see online when educators are teaching. They just go through the big long list, when in fact, if you're in practice, there's usually just a few causes that you see all the time. And that's definitely, in my case, I see, the high blood pressure is number one with the medication for 20 years. And then there's some other little issues like the blood sugar as well. But the number one that I see, which were always some of my first cases of treating kidney failure, were due to excess protein consumption. And so weightlifters, for example, or just big muscle guys would come in and they were so shocked. I remember one of my cases was only in his late 30s. I've had a few cases of men in their late 30s, and they were, just working on building muscles. One was a professional muscle builder. He was quite a big, buff guy. And you just look at their diet. They're having raw eggs, meat, hamburger, plus protein powders. So we know that, there's a metabolic waste product or the byproducts of protein metabolism, such as uric acid and urea. These are a big burden to the kidneys, and that's part of the kidney's job, is to get these out. But, if you're a healthy person, maybe you're going to get this out and you won't see the damage, at least not in the short term. But maybe you had a secondary problem like high blood sugar or a little high blood pressure or something like that. And then that's when it can, progress and accelerate, let's just say, kidney damage and progress towards kidney failure. So I still get a steady stream of people from the gym, people who are focused on building muscle, and they're all taking protein powders. And nowadays, of course, we have these fad diets where there's no carbs, and we have things like the keto diet, and we have the paleo diet and carnivore diet, and so these are the source of the cause, and that's why I always speak against these kind of extreme diets. And of course, I remember 20 years ago when the big extreme diet was the vegan diet, which we really don't hear much about anymore. Now everybody's gone to the other extreme. And this is like this keto, and there's some people that believe it's a cure for everything. And this is creating a lot of health problems. And in fact, the amount of people coming to me with kidney failure has increased as the keto diet has increased in popularity. But I do believe, from my experience, that the keto diet by itself is probably not the cause, at least not in the short term. Not the cases I'm getting that are starting to have early stage kidney failure in the first couple years. It's these people usually have a secondary condition like high blood sugar. And that's one reason they often get on the keto diet, is because they had the high blood sugar, and, eliminating all carbs and eating a lot of protein and fat, brings down the blood sugar. But maybe they had this blood sugar for some time. And as I mentioned, that damages the kidneys. So maybe they have these spiking high blood sugar plus this high And maybe the kidneys were already damaged from years of having high blood sugar. I don't know. And then they went on the keto diet, and the body wasn't able to get rid of the waste product from all this excess protein, damaged the kidneys. And then they started seeing symptoms like swelling and fatigue, and went to the doctor, and they told them you're early stage kidney failure, sometimes even later stages, and unknowingly. So, of course, I was treating people for kidney failure before the keto diet existed. And I learned in India, I don't follow the diet, which is mostly prescribed. I don't know where this information comes from. Well, I kind of do. They just believe that getting rid of potassium and salt is going to solve the problem. But that's not the focus in the Ayurvedic diet. The big focus of the Ayurvedic diet is low protein and no animal protein. And there's other little tricks about leaching the vegetables and things like that, which they did in ancient times, which now we know, potassium comes out in the water. So you can throw the sweet potatoes in the water and just boil them and pour the water off, and all the potassium comes out. So you don't even have to worry about this whole concept of no potassium, which is what they tell people with kidney failure. But it's like telling people with high blood pressure, stop salt. Well, sure, salt can make it worse, but stopping it doesn't make it better. And that's the same with their kidney failure diet, is no potassium, no salt. And they just focus from this nutritional point of view. But I'm not going to get into the Ayurvedic diet for kidney failure, because every case, again, is different. Because if you have high blood pressure plus kidney failure, you're going to get one diet. And if you have diabetes plus high blood pressure and kidney failure, you're going to have the most restrictive diet. So I'd rather not give out restrictive diets, but the more health conditions you have, the more restrictive it's going to be. And I do get people who weren't even having super high protein diets, not doing protein powders. That's usually one of the big causes. Protein powders are very popular with men. They're just consuming too much protein. It's very hard to have too little protein. You'd have to be like an extreme vegan with no animal protein, no dairy, and then not do beans. I mean, as long as you're a vegan and you did enough beans, you would probably get enough protein, but not every vegan does the beans. So you do get people, the only people probably in the world on not getting sufficient protein would be an extreme vegan, not doing any legumes. But and most people will going to get sufficient protein. It's not going to be very difficult. I mean, you could just have a couple helpings of legumes once a day, and you'd get enough protein. So there's, protein deficiency is extremely rare in the Western world. I mean, obviously in Africa, or places where there's extreme poverty, they could have it. But even in very poor countries, they often have big bags of beans and things that they're eating, and they can get sufficient protein from just the legumes, which is a really good source of protein. This is a plant source of protein is the legumes. And that's generally what you have to eat once you have kidney failure is, legumes as your source of protein, because you don't want too much. And so it's very difficult to not have enough protein. So really almost nobody needs to be taking protein powders. Unless all you want to do is build muscle and you don't really care if you have kidney failure later in life, then, we're all free to follow our own path. But I would never advise anybody to take protein powders because you're just burdening your kidney with more work to, break down this protein. And the waste product of animal protein in particular is creates a lot more toxins than the plant protein. So those are the causes. So I think I summed it up. Again, like I said in the beginning, I don't want to talk about the cure because that's quite complex. Not the diet's kind of very individualized, and the herbal remedies are very much dependent on, the case and other cofactors. And of course, there's the creatine number, which would really show the whole health of the kidneys. If that's very high, over 7, for example, the treatment's going to be completely different than somebody who's just maybe 2. And then the EGFR, this is the flow rate through the kidneys. This is usually your first sign your kidneys are going downhill. When this number starts to get low, even in the 70s, I would be concerned. You really want to have it in the 90s, your flow rate, like say 100, I guess is about 100%. You're just flowing right through your kidneys with no blockage. But unfortunately, when you do your lab work, and I would look at your lab work and look at the EGFR under your metabolic panel, and usually the cutoff point to put you in the unsafe range is at 60. So already, 40% approximately of your kidney failure is gone, or the flow rate, you're being blocked 40%. And, if you're at 61, the doctor's not even going to mention it. So even if people are in the 70s, I would encourage you to start the treatment early and not just wait around for your kidneys flow to become so poor that you then have to start treatment. Because if you're already down to like 55, well, how'd you get there? Slowly from 90 to 80 to 70 to 60. Now you're in the 50s, so it's been dropping steadily over the years, and nobody's been telling you because you were over 60. This is the EGFR, so that's why I tell people even in the 70s, start treatment now, make changes now, so that you can stop it from progressing. But most of my cases in kidney failure are already very much lower, and they're like 20s. And I think when you get about 20, you got to go on dialysis. And so people panic at 28 and 31. That's when they contact me. Unfortunately, they waste a lot of time trying things online, and there's really nothing that can reverse this kidney failure but herbal remedies. So they try a lot of things, and even taking a lot of vitamins and supplements that are synthetic. Usually I have to stop all of that because this can be a burden to the kidney as well. And unfortunately, a lot of people just start taking more vitamins and supplements, and often they don't even stop the kidney, the protein powder. So they waste usually years in there before they contact me, even if they know me, by, I guess they don't realize I can treat it because it's considered untreatable. And, so they go to the doctor, and there's really no medication. And the doctor tell you don't have foods with potassium, which doesn't really slow it down. Then, people go online for another 3, 4, 5 years. Meanwhile, it's just progressing. And then when they get around in their 30s, then they seem to suddenly contact me as a last ditch. And that's just a pattern that I'm seeing, of people waiting too long to at least contact me. I think it's just the disbelief that, I can treat it when all these medical doctors can't. But you have to understand, I mean, they only have medicine, and all medicine you're taking is damaging your kidneys. So they're trapped. There's nothing they can do, because even if they had a medicine, it's going to harm your kidneys. And the diuretics that you take a lot of times for blood pressure can further damage your kidneys. So sometimes people are taking a couple medications for their blood pressure, like ACE2 inhibitor, plus a diuretic, and both are damaging to the kidneys. But again, it can take about 20 years. So I get people in their 50s who have been on blood pressure medication for 20 years, who now have kidney failure. And I tell them to go to your doctor and ask the doctor whether the medication was the cause. And the doctors have acknowledged, yes, they do believe that was the cause. So I have discovered that doctors are well aware that taking these medications, particularly for high blood pressure for long periods of time, leads to kidney failure. I guess nobody just talks about it in the beginning, but apparently it's in that small fine print when you have that medication. And then, of course, like I mentioned, all medication, even cheap supplements, are going to burden your kidneys. So, kidneys are very sensitive. Fortunately, we have two, and that often just puts off the problem. See, one kidney can be failing and you don't have any symptoms because the other one's still working. So on one hand, it's brilliant that the human body has two, because you don't last failing, and you won't notice it because you have two. So it's a tricky one, and people feel very trapped once they have it, because the only process, or the only path out, is dialysis, or kidney transplant, which of course has a lot of complications, and you have to take medication for the rest of your life. So I hope this helped you avoid, kidney failure. and stop your protein powder and stay away from keto diets for starters and have a more balanced diet, particularly of your protein. That's kind of the main intention of this, is to, hopefully prevent more kidney failure cases, because I'm definitely seeing more and more cases. Once again, just because you're on the keto diet doesn't mean guaranteed you're going to get it, but definitely the probability is higher. And like I said, most people on the keto diet have, a lot of them are going on because of other conditions like blood pressure, and particularly high blood sugar. Okay, well, be careful. Watch out for extreme diets. Be wise. Have common sense. And I wish you all the best of health and happiness. And of course, if you do have kidney failure, please contact me sooner rather than later. Thank you very much.